Welcome back, everybody. Let's talk about sleep. So, in the last video, I talked about CPAP, and a couple videos before that, we talked about obstructive sleep apnea. This time, I want to talk about something a little bit different: BiPAP, or Bilevel PAP. Now, if you remember from last video, PAP, positive airway pressure, is either CPAP, right, continuous positive airway pressure, which we use for snoring and obstructive sleep apnea. APAP, or auto-PAP, that's auto-adjusting positive airway pressure, also used for snoring and obstructive sleep apnea. But what is Bilevel, or BiPAP is the, it's kind of like the brand name of it. What that is basically two different pressure settings. Okay, so the pressure goes up as the person breathes in, and the pressure goes down as the person breathes out. Now, why would somebody be on this versus CPAP? Okay, so what CPAP is used for is, we said, there is a blockage here. So somebody has obstructive sleep apnea, obstruction back here, okay, back where the tongue sits. So pressurized air is going in there and splinting, okay, forcing the airway open. So the person is able to breathe in, breathe out against this pressurized air, but basically it keeps the airway open. They have no problems. Okay, that's somebody who has no lung issue. All right, but what if somebody has an obstruction here, okay, and or a lung issue like COPD, right, from smoking, or emphysema, or really bad asthma attack, right, or respiratory failure as a result of that, or somebody who has heart failure? Okay, in these situations, the lungs themselves are not working great. So there may be a blockage here, right, an obstruction here, but there's also something going on in the lungs, right? So people who have garden variety obstructive sleep apnea, the lungs are working fine. It's just that they can't get air in because it's a blockage here. Whereas these other conditions, they may, in conjunction with obstruction or alone, have problems with the lungs themselves. Okay, so what Bilevel, or BiPAP, does is it basically it allows for, on a kind of a cellular level, it allows for exchange of gases, right? So when we breathe in, we take oxygen in from the environment, and we breathe out carbon dioxide. What a BiPAP does is it allows for that exchange to happen in a more efficient way, and it reduces the work of breathing, as it were. Okay, so again, you're pressurizing the airway. Okay, so you're making the airway wide open here. Okay, because a lot of times these patients will have obstructions as well. But down here where the lung sits, where the lungs are rather, you're basically increasing what the lungs do normally. Okay, so you're basically you're allowing the person, when they breathe and when their muscles are all relaxed, you're allowing the lungs to do what they're supposed to do by adding to them. Okay, supplementing what they do. All right. So we use BiPAP in certain circumstances, okay, just like I'm describing here, again, where somebody has respiratory failure or impending respiratory failure, or we're trying to prevent respiratory failure. The Bilevel machine, the BiPAP machine, reduces how hard the person's body has to work to take oxygen in and let carbon dioxide out. It's a simplified way of the way I'm describing it, but that is what it's used for. So, because of COVID and everything, people have been asking me, well, would it be better if I'm on a BiPAP machine? Not necessarily. Okay, again, this is when the lungs have started to have problems. All right, now if somebody is in the hospital, right, if somebody's hospitalized, yes, BiPAP is usually used in that cases because the lungs are not doing what they're supposed to do. But if somebody is just walking around and fine, but they have obstructive sleep apnea, a CPAP is going to be okay. Okay, so that's the difference. That's basically where the two differences lie. Now, like I said, if somebody has pneumonia and they get critically ill and they do end up in the hospital, yes, they will use BiPAP in those situations. Or if somebody has pre-existing lung conditions and then they get COVID or get pneumonia or so, yes, they're probably going to need BiPAP, probably at home as well. But BiPAP is used for certain circumstances, special cases, whereas CPAP is used for garden variety obstructive sleep apnea. Okay, so hopefully that kind of clears some things up in your mind. I get that question quite a bit. And if you do have questions, please ask them in the comment section below. And as I always say, these videos are just for educational purposes. If you have specific questions about yourself, I mean, certainly you can ask them in the videos here, and I'll try to answer them. But this is not meant to supplant medical decision making by your provider. So always talk with your medical people. Okay, and this book, the Amazon description, or the Amazon link is in the description box below. If you like it, please click subscribe, please share with your friends, and if you guys have any videos you want me to talk about, or any topics you want me to talk about, please let me know. Until next time, sleep well, folks.